Hello, I'm Terrence Affer Anderson, and this is Health Watch. So, why am I wearing a lab coat today? Many of you know that I have a little bit of a background in the theater. I write, produce, and direct plays, documentaries, and film, oftentimes for the health department because they are simply great teaching tools. So today on Health Watch, we're going to stage a dramatization for you. And I've called upon one of my best friends and theater collaborators, well-known local actor Michael Lamel, founder and president of the Lamel Group, to help me. So, throw some popcorn in the microwave, sit back and be enlightened and entertained. Here we go. Good afternoon, Mr. Wilson. How you doing today?
Hey, Doc. Well, you know, all that really depends on the stuff that you tell me and what you have to say.
Okay, let's begin with the simple stuff first.
Okay. We can do that, but as long as you don't have any needles or that thing around your neck, you know, none of those funny looking tools or nothing, we'll be all right.
You aren't squeamish, are you, Mr. Wilson?
No, man, just pulling your leg.
Yeah, right, okay. Okay, so listen, when was the last time you've been to a doctor?
Whew, it's been a long time.
How long?
I can't remember, to be honest.
That long, eh?
Yeah, really.
How old are you, Mr. Wilson?
I'm 41, but I look good, don't I?
I'm more concerned about how you look on the inside. And you can't even remember the last time you were examined by a doctor. Do you realize that the Centers for Disease Control and Prevention, the report Health United States 2009, it says that men in your age bracket, men from ages 18 to 44, are 70% less likely to visit a doctor than women, and are 80% less likely to have a regular source of health care.
No, I didn't know that, Doc, really.
And according to the 2008 National Healthcare Quality and Disparities Report, the numbers are even worse for minority men. For instance, it reported that in 2005, all men were 30% more likely to be uninsured for the previous year compared to women. However, within that group, African American men were 70% more likely to be uninsured than white men, and Hispanic men were 3 times more likely than white men not to have any insurance at all.
Really? Wow. Well, Doc, I have to tell you that, well, I don't have any insurance myself, all right?
I understood that, Mr. Wilson. Let's just say that if you promise to stay focused on getting your routine health screenings done, this one is on me.
Really?
Absolutely.
Thanks, Doc. I mean, that surely works for me, really. So what do I need to do? I mean, what do I need to have done? I wrote down some questions myself, too, because I had some questions and notes that I wanted to talk about.
Good for you. You came prepared. Let me tell you about the recommended screenings for men. First up, blood cholesterol. You should have your cholesterol checked regularly starting at age 35, but beginning as early as age 20 if you have certain risk factors. Blood pressure. You should have your blood pressure checked at least every 2 years. Colorectal cancer. Regular screening for colorectal cancer, also known as colon cancer, should begin at age 50 unless earlier screenings are recommended based on family history, medical history, and lifestyle. Diabetes. You should consider being screened for diabetes, high blood sugar, if you have high blood pressure or high cholesterol. Depression. If you felt sad, down, or hopeless, or have had little interest or pleasure in doing things for 2 weeks straight, you should talk to a doctor about whether he or she can screen you for depression. Sexually transmitted diseases. You should consult with your doctor to see whether you should be screened for sexually transmitted diseases, STDs, caused by viruses such as HIV and herpes. Prostate cancer screening should begin around age 40, unless, again, there are other factors such as ethnicity and family history that place you at risk.
Man. That's a lot that I haven't been taking care of, Doc.
You've been a little negligent, sir.
Yeah, I mean, you know, the doctor, it just, I don't know, it makes me nervous. That's like most black men, you know? Tell me more about these tests, though, Doc. I mean, and about this cholesterol thing. I want to know Under what circumstances should someone get tested or screened before the age of 35?
If someone smokes, is obese, has diabetes or high blood pressure, or have a personal history of heart disease or blocked arteries, or if they have a man in their family who had a heart attack before age 50, or a woman in the family who had a heart attack before age 60, they should begin being screened for high cholesterol as early as age 20.
Really? Oh, that's good to know. So why is it such a good thing to stay on top of this blood pressure?
An indication of hypertension, high blood pressure, is generally a reading of 140/90 or higher. High blood pressure can cause strokes, heart attack, kidney and eye problems, and heart failure.
Man, that means unchecked hypertension can be serious.
Indeed.
But you mentioned colorectal cancer before. Can you tell me about that? I mean, colon cancer and something else I heard about, colorectal polyps.
You've done some research.
I have.
Very good. Colorectal polyps and colorectal cancer, also known as colon cancer, it doesn't always exhibit any symptoms, especially at first. Someone could have polyps or colon cancer and not be aware of it at all. That is why getting screened is so important. You should get screened regularly. If there are symptoms, they may include blood in or on your stool, stomach pain, aches or cramps that won't go away, losing weight and not being sure why you're losing weight.
What can you tell me more about diabetes?
You should consider getting screened for diabetes if your blood pressure is higher than 135/80, or if you're taking medicine for high blood pressure, hypertension. Diabetes can cause problems with your heart, with your brain, eyes, feet, kidneys, nerves. You've probably heard of neuropathy. That is, diabetes can cause neuropathy and other parts of the body.
Wow. You know, Doc, I just found out that a friend of mine, well, he just recently found out he had HIV, and he doesn't even know how long. Yeah, it's pretty serious. This was the first time that he ever got screened or anything, and he finds this out. You know, I was wondering, what age, when should somebody get HIV screening? I mean, is a certain age, or is too young or too old, or what?
No, not necessarily any age. There are things that, situations that may apply that suggest that you get an HIV screening. I want to tell you that I'm very sorry to hear about your friend. I would also say to you that over the years, there have been improvements in the treatment of HIV. So though it remains a serious condition, there have been advances that are made that we can manage it much better than we could in the past. But these following situations apply where you suggest you might want to get screened for HIV. That's if you have had unprotected sex with multiple partners, if you've had sex with other men, if you use or have used injection drugs, if you've exchanged sex for money or drugs, or have sex partners who have, if you are being treated for a sexually transmitted disease that makes you more susceptible to contracting HIV, if you've had a blood transfusion between the years of 1978 and 1985, or if you simply have other concerns, you should get screened for an STD and HIV.
Doc, that's hitting real close to home. Because you know what else? I found out another friend of mine recently that just got diagnosed with prostate cancer. I mean, that's serious too. All of it is. I mean, what are the screenings for prostate cancer? I mean, I haven't heard a lot about it, but I do know about one. It's kind of like that taboo, forbidden thing among men, it's particularly black men. You know what I'm talking about too.
I know exactly what you mean, Mr. Wilson. You're talking about the digital rectal exam, the DRE. You know, but I don't understand it. If a simple test can possibly save your life, why not get it done? You know, men should know that doctors don't look forward to doing that particular test either. The DRE checks for lumps on the prostate, it checks for the size of the prostate, it checks for any abnormalities on the surface of the prostate that might suggest that something else is going on.
Well, isn't there another test that should also be done?
That's the prostate-specific antigen test, the
Yeah.
PSA test. Now, this is a blood test which measures the level of prostate-specific antigen in your blood. The PSA is a potential marker for cancer.
Gotcha.
Now, if the abnormal levels of PSA, that may suggest again that something else is going on. Now, if your DRA and your PSA, particularly in those kind of circumstances, are beyond normal range, your doctor might recommend a biopsy. Now, what the biopsy does is it gets tissue samples to be further analyzed for further testing.
You said that men should be screening for prostate cancer around the age of 40, but my friend Doc, he got diagnosed at 38. I mean, 38 years old. Yeah, what do you say about that?
Yes, but I also said that there may be risk factors that suggest testing should begin at an early age. Race and family history are very important contributors to whether or not someone should be tested for prostate cancer at an earlier age. The CDC reports that African American men have the highest incidence of prostate cancer diagnosis, followed by white men, Hispanic men, Asian American men, Pacific Islander men, Native Alaskan and Native American men. However, African American men also have the highest incidence of prostate cancer deaths, followed again by white men, Hispanic men, Indian American, Alaskan Native, and Asian Pacific Islander men.
Wow, that's heavy.
There's more. Do you know that African American men in Hampton Roads are believed to have the highest incidence of prostate cancer deaths nationwide?
Really? No, Doc, I didn't know that. I didn't know that at all. So can I get screened today?
Are you sure that you're really up to it? You know, we're going to be doing a couple of different tests here. You've been a little slow about getting things done.
Absolutely. I'm very positive. I mean,
Very good.
I should get it done today. And you know what else? I have a message for any men who are reluctant about it. I mean, I know I was too, and who seem a bit anxious about doing it. I just tell them to man up.
It's a good thing.
They need to.
So, Mr. Wilson, do you have any other questions today?
I'm curious about immunizations. I think that's the last thing, like a flu shot, and this other thing I heard about called Tdap. Can you tell me about those?
Sure. I'm very pleased to hear you ask about flu shots because I suspect that you don't get a flu shot every year, do you?
You're all on my street and pulling my car. I don't. And I figured you were going to ask me about that too. I did.
Well, you know, the best protection against influenza, the flu, is to get a flu shot every year. The reason that is the case is because the flu virus tends to mutate from year to year. The flu shot that you get every year actually provides protection from 3 to 4 different viruses that research suggests are going to be the indicators, well, the type of viruses that are taking place during the upcoming flu season. So you should get a flu shot every year.
I figured that. There's this other thing, Tdap. Can you tell me about that and tell me exactly what it is? I just heard about it.
Well, let me tell you some people that are at particular risk if they don't get the flu shot. These are people that are susceptible to serious complications like pneumonia.
Really?
These people include people who have certain medical conditions such as asthma, diabetes, and chronic lung disease, pregnant women, children younger than 5 years of age, and especially those younger than age 2, and people aged 65 years and older. People who live with or care for others who are at high risk or developing serious complications. These are household contacts and caregivers of people with certain medical conditions, including, again, asthma, diabetes, and chronic lung disease. Household contacts and caregivers of infants less than 6 months old, and healthcare personnel. I get a flu shot every year.
Wow, that's a lot of people that are potentially at risk.
Indeed. Now, let me tell you about the Tdap. You had asked about the Tdap.
Yes.
The Tdap is a combined vaccine that protects against tetanus, diphtheria, and pertussis. Pertussis is also known as whooping cough. It is recommended for children between the ages of 11 to 18, and it is also recommended in a single dose for persons from 19 to 64 years of age, a single dose that is given during the routine tetanus booster. In 2006, the Centers for Disease Control and Prevention recommended something called a cocooning strategy. A cocooning strategy is creating a protective cocoon around infants by vaccinating those people who are going to provide care for those infants, caregivers and healthcare personnel.
Wow. Man, we talked about a lot today, Doc. Where can someone go, or can they call somewhere if they have more questions? Can you tell me?
Well, they should also check with their doctor. They should consult with their doctor. But if they have general questions, they can go and get information from the Centers for Disease Control and Prevention website. That's www.cdc.gov. They can also find helpful information at the Virginia Department of Health website. That's www.vdh.virginia.gov.
Oh, okay. And what about that that Norfolk Health Department show, Health Watch?
I'm glad that you asked that question, Mr. Wilson. If they want more information on Health Watch, they can call 757-683-8836. Again, that's 757-683-8836. They can also see previous editions of Health Watch online at www.norfolk.gov/healthwatch. Well, Mr. Wilson, that concludes our assessment for today. I want to thank you for coming in. I'm very pleased that you took the time to come in and just simply ask questions.
Thank you for having me. I'm going to get my test done today. I'm going to figure out how to get my nerve up, because I have to get that flu shot as well.
And make sure you spread the word to other men, particularly African-American men in the community.
I will.
Thank you very much, Mr. Wilson.
Thank you for having me.
And that concludes our scene for today. We're going to ask you, though, to please stick around, because we're going to have some general conversation. Again, this man here is a good friend of mine, and we're just going to talk very frankly about health care. But for right now, we're going to take a bit of a break, and when we come back, Michael Lamel and Terrence Afriandis, some good friends, are going to talk about health care. Stay tuned.
Any questions?
What kind of service plan does this come with?
Unlimited.
Can I keep my same phone number?
Absolutely.
How do I change the ringtone?
Just hook it up to your computer.
Does it have a camera? What's the warranty? Does it come in silver? Can I put my party shuffle on this? Does it have a 3.5 millimeter headset jack? You sell a lot of these?
It's the one I carry.
You ever get those phantom vibrations in your pocket?
Any questions?
No.
Are you sure?
Yeah.
Ask questions. For the 10 questions everyone should know, go to ahrq.gov.
Welcome back, and thank you for joining us today. Michael Lamel and I, my guest for today, we're going to have some very frank conversation about getting health screenings and going to visit your doctor and the importance of such. Michael, as we were talking earlier, you mentioned that there were 3 men in your family that have been diagnosed with prostate cancer.
Yes, sir.
Yeah.
My uncle, who has recently, we lost him to that.
He actually died from prostate
cancer.
Yes,
and it caused other complications as
Certainly.
well.
Yeah.
And I have 2 uncles now with it who are still living, who have been diagnosed. My father's brother, the only brother that he has living, and another one of my mother's brothers, and who is actually in a home situation at the moment, which is causing other complications as well. And I'm very proud to say, though, that last year I had my first screening done, and I manned up and got it done. And it was at the Illuminating Health Fair with Norfolk Health Department.
That we did last year.
Yes, and I'm very proud of that. I was had stuck my chest out and told all the men that I knew, I challenged them, so to speak, to get theirs done, because I had it done. And it was not as traumatic or as bad a thing as that they perceive. I think it's just a matter of conditioning, that they think that it's this horrible horrible thing to have done. And it
You're
in fact
speaking
was.
right now of the digital record.
Yes, the DRE. I'm just learning what the proper name for it is, but I was very apprehensive, and I'm not ashamed to say I was very apprehensive and anxious and reluctant, but having it come close to home with family and knowing that there's a family history can have a direct influence
Indeed.
on your own body
Indeed.
and the things that happen within yourself. It provoked me to do it.
When I was diagnosed, I insisted that my two brothers, one older than me and one younger, be screened.
Yes.
And it was a good thing because my elder brother was himself diagnosed.
Really?
Yeah, and
really,
my younger brother was not.
Right.
So we talked, and we talked a little bit earlier about the DRE and the reluctance. For you, now that you've had it done, it was not as big a deal as you might have thought it was. And all one need do is look at it as a part of a routine medical exam.
Yes, I was, in hindsight, which we often say is 2020, I was not traumatized, and actually I was quite relieved to know that I had had it done, and there was nothing to be afraid of, and the diagnosis was negative. Particularly having this history of it in my family.
So you're going to stay on top of it.
I will get it done every year, and I'm calling all the men, because it's a call to arms for all the men in my family and just in the community, because I'm learning that we have the highest rate of it, one of the highest rates in the country, if not the highest, here in Tidewater, and simply it can be avoided to be, it can be caught early enough by having a simple test done.
Let's talk just a little bit in the amount of time we have left about breast cancer and African American women.
Yes.
We know that compared to white women, African American women do not receive as a higher rate of diagnosis for breast cancer. But when it comes to death from breast cancer, that African American women have a higher rate of death.
Yes.
Okay, so they have a lower rate of diagnosis, but a higher rate of death.
Right.
Once they have been diagnosed. So that suggests that that women are not doing the preventive screenings that they need to get done, and maybe in fact need a little bit of training in that.
And encouragement. I think that it's twofold, that the male, African American male community can encourage the women to do that, and the women can encourage the men to have their own screenings done. I don't think that there is enough communication within our community with regards to health. We talk about everything else, but health is a bit of a taboo thing. A lot of it rests on the fact of not having health insurance, or just so money becomes an issue,
underinsured.
or being underinsured. Right. So it becomes a problem. But and in fact, I'm sure you know this is Breast Cancer Awareness Month in October. But I've been an advocate for some years now for getting people aware about breast cancer, and then finding out last year that my children's mother, my wife Erica, was diagnosed herself with breast cancer.
And you're sure she's okay with you mentioning that on television?
Yes, okay. She is.
It seems like a real advocate.
Yes, she is well now. She's gone through all this rigorous treatment with chemotherapy and radiation and things like that.
And she looks good.
But she does. She looks good. Her hair is back. And we've been encouraging her. Social media has taken up arms, her church family, and just supporting her. And I think that, again, with lack of communication, and it also leads to lack of support, which helps to grow different fears and things. Because, number one, we can diagnose these things a lot earlier and get them they're very treatable at an earlier stage but we have to be encouraged to get the treatment, the diagnosis done, the checkups done.
One thing that we learned from doing the different events like we did last year is that when it comes to African American men, the women play a pivotal role in ascertaining that the men get the screenings that
Yes.
that they need to get done.
Absolutely, absolutely. I've always been a fan of the idea that our whole community situation could change from a woman's perspective, and by that I mean the women are our first teachers of children. They are the reason why many men do the things that they do. so they have a way of.
Well, before you get yourself in trouble, yeah, we're going to have to pretty much come to a close.
Oh, okay.
Yeah.
I enjoy talking to you all the time.
Yeah, we can do it afterwards, of
Yes.
course. But I want to thank you so very much for coming and joining us today.
Thank you for having me. Thank you. I enjoyed myself. Had a great time.
It's always good to be on stage with you, right?
Yes, always.
And we want to thank you for joining us today for this edition of Health Watch. If you want to see previous editions of Health Watch, again, you can go online to www.norfolk.gov/healthwatch. You can also call us at 757-683-8836. You can call me directly at that particular number. And my email address is terrence.affer-anderson@vdh.virginia.gov. So we want to close today by saying, I'm Terrence Affer Anderson, and I'm not really a doctor.
Just play one on television.
Yeah, that's it.
And I am Michael Lamel, and you can reach me at www.michaellamel.com. And I am certainly not one of his patients.
Oh, I wouldn't want to do a particular exam, Michael. Thank you so very much.
Thank you for having me.
And ladies and gentlemen, this has been Health Watch.